I'm Rana Awdish. I'm the author of In Shock, How Nearly Dying Made Me a Better Intensive Care Doctor. And I'm going to read a short excerpt from when I first went into the hospital. I was 7 months pregnant and bleeding internally. "Bear with me," the obstetrical resident warned, his foot tangling in the cord. "I'm not great at these yet." He didn't need to be. Here I could still be a physician. From the first grainy images, I could see the small ventricles still and pulseless, like a four-chambered pool filling with slowly falling snow. "There's no heartbeat." The words cascaded out of me on a torrent of agonized breath. "Can you show me where you see that?" he asked. The words reverberated in the suddenly hollow space behind my eyes. I heard my own gasp and shuddered in a shock of pain. It was as if the subtle movement of my diaphragm with the breath had spread open some barely healed gash, freshly exposing the injury. As my breath caught, I stared at him, incredulous. Could I show him how to interpret the ultrasound images of my dead baby? I felt an emptiness begin to envelop me from the inside, a kind of meditative panic. The baby we'd imagined, that was at least transiently, very real and tangible, was dead. I was dying as everyone watched. A room full of doctors and none of them able to grab the yoke to save me from crashing into the sea. Can you show me where you see that? The baby, having declared her own distress, meant that the surgery I'd been begging for came easily now, briskly even. I was pulled so quickly into the operating room that my IV pole struck the obstetrical resident in the face. He had never met my gaze. He was still attempting to decipher the ultrasound images on the screen. Although, by all accounts, I'd been begging for the surgery, I never actually believed I would survive it. I had heard my lab values recited gravely. I knew I had almost no circulating blood volume with a hemoglobin of 3. I knew I had almost no platelets, the component of the blood responsible for clotting. There hadn't been time to arrange for cross-matching and transfusion, so there was no hope of the numbers improving at any time soon. I knew I was already in shock, with a blood pressure so low that it was barely detectable. Patients like that don't survive a surgery. I remember the frigid operating room and the blue blur of scrubbed bodies moving briskly, voices muffled by masks in a way that recalled scarfed children in winter. The square, snow-covered tiles covering the walls. The cool smell of volatile alcohols, the steel of the table, the drain in the floor to hose the still warm blood into. The scrub tech pouring betadine on my abdomen as a quick prep for the incision. It was as cold as gasoline. As they began sedating me, I heard the anesthesiologist's voice, "We're losing her. Her systolic is 60. I was drawn back into myself from failing consciousness by those words. Are they losing me? I attempted to survey the situation. "We're losing her." Words echoed, or were they repeated this time? "Guys, she's circling the drain here." "You know I can hear you," I thought. I struggled to maintain consciousness, trying to surface against a submersive force, a weighted pull into an obliterative darkness. My arms were so heavy and stiff. A movement of a millimeter was an impossible effort. My eyes darkened. My throat tightened. I sank below the still surface of the water. A heavy water that was dense as mercury, the crush of it accelerating my descent. And then all at once, I felt a sudden release and lightness. I could see the operating room clearly, although I struggled to orient myself. The view was deceptive in the way pilots staring for too long at the horizon can sometimes suffer a sensory illusion that causes them to mistake the sea for the sky. My orientation was inverted. I was falling up. I could see the frustrated anesthesiologist who was working on placing IV access as I crashed. I could see the monitoring equipment surrounding me, the obstetrical team readying with instruments to extract the baby. I could see myself on the table. It struck me that they were right. They were losing me. If I could see myself, perhaps I was already lost. I felt nothing, the pain miraculously gone. The panic surrounding the pain was gone. An anodyne peace. I felt weightless, buoyant, and very small. I watched the events unfold before me, unattached to any outcome, with an easy stillness. I had died.